45-year-old female presents with a painless palpable mass on the lateral aspect of her knee. I am showing you coronal T1, coronal T2 fat saturated, and post-contrast fat saturated T1 coronal magnetic resonance images. Please describe the findings.
The magnetic resonance images demonstrate a well-defined, lobulated, cystic fluid collection located deep to the iliotibial band. It is ice-intense to muscle on T1, uniformly hyperintense on T2, and shows only a thin, smooth rim of peripheral enhancement on the post-contrast image, with no internal solid components.
What is your primary diagnosis?
The findings of a well-defined, lobulated cystic collection, showing only thin rim enhancement near a joint, are diagnostic of a ganglion cyst.
What is the wall composition of a ganglion cyst, and how does this pathologically differentiate it from a true synovial cyst?
A ganglion cyst wall is composed of dense fibrous tissue and spindle cells, and it lacks a true synovial lining. A synovial cyst is lined by synovial cells and typically communicates directly with the adjacent joint cavity.
Why can a ganglion cyst occasionally demonstrate high signal intensity on T1 weighted magnetic resonance images, mimicking a solid mass?
This can occur due to a high concentration of proteinaceous or mucinous content within the cyst fluid, or from prior intracystic hemorrhage.
Where do ganglion cysts most commonly arise, and from which structures can they originate?
They most commonly arise in the hand and wrist. They can originate from joint capsules, tendon sheaths, ligaments, bursae, or even subchondral bone, in which case they are called intraosseous ganglion cysts.
What key post-contrast magnetic resonance imaging feature is critical to exclude a cystic sarcoma or an active abscess?
The presence of a thin, smooth, uniform rim of enhancement without any internal nodular or solid components rules out a cystic sarcoma. The lack of thick, irregular wall enhancement or surrounding soft tissue inflammatory edema helps exclude an abscess.
What are the characteristic ultrasound findings of a ganglion cyst?
On ultrasound, a ganglion cyst typically appears as an anechoic or hypoechoic lobulated structure with posterior acoustic enhancement, showing a well-defined, thin, hyperechoic wall and no internal vascular flow.
Finally, what are your clinical management recommendations?
Asymptomatic cysts require no treatment. If the cyst is painful, causes mechanical limitation, or compresses adjacent neurovascular structures, management options include ultrasound-guided aspiration and corticosteroid injection or surgical excision.